Hello, I'm Melissa. Ashlyn and I did our project on a classic central nervous system stimulant, methylphenidate. The common brand names are Ritalin and Concerta, and it's a fully synthetic drug that's Schedule II. It was initially synthesized in the 1940s, and its purpose was to reverse barbiturate-induced comas, but really it would reduce any coma that was induced by a central nervous system depressant. It has since evolved into primarily an ADHD medication, but has many developing off-label uses, such as relieving apathy in Alzheimer's patients, keeping narcoleptics alert, and to treat fatigue in cancer patients. If it's used as intended, it can alter behavior and most commonly cause irritability, anxiety, and restlessness. When used excessively or abused, it can cause more severe behavioral effects such as paranoia, delirium, and psychosis. But in almost all cases, effects are reversed after the dosage is adjusted. As mentioned, it is now mostly used as an ADHD treatment, but specifically it's commonly prescribed to children. It's taken most commonly as a pill orally, but is also available transdermally. And since it's marketed to children with ADHD, it's very commonly available as a chewable tablet. When taken orally, there's the option of extended release pills, which are really useful when treating attention deficit or narcolepsy, because this method delivers part of the dose rapidly and the rest at a more consistent and steady rate. When ingested, it's absorbed in the small intestine, and if used transdermally, it's absorbed through the skin. There are a lot of contradictory studies on whether food affects absorption in the small intestine. The general consensus, though, is that when taken after food, it can increase the extent of absorption, but not rate. There have also been studies where methylphenidate has been administered to some groups before a meal and others after, and there were no notable changes in reported effectiveness. The effect of food on absorption also varies drastically depending on if the drug is immediate release or not. Methylphenidate has a half-life of about 1.5 to 2.5 hours and is subject to first-order elimination, so how quickly it leaves the body is correlated to the dosage. The drug is also extremely lipid soluble, so it doesn't depot bind. And since the drug is primarily taken orally, it undergoes first-pass metabolism, where an enzyme in the liver converts the drug to the metabolite retinoic acid, where it's then excreted through the urine.
Okay, so the mechanism of action for methylphenidate is very similar to that of cocaine. It functions as an indirect agonist by binding to dopamine and norepinephrine transporter proteins and inhibiting their function. Usually these transporter proteins are responsible for transporting dopamine and norepinephrine back to the presynaptic cell after their release, but when they are non-functional, this prevents the reuptake of dopamine and norepinephrine and allows them to sit in the synapse for longer, exerting their effects. The most well-understood mechanism of methylphenidate tolerance is pharmacodynamic tolerance, which results from an upregulation of dopamine transporter proteins that in turn reduce the effectiveness of the drug by quickly removing the dopamine from the synapse. This means that you would require more of the drug to occupy the increased number of receptors in order to achieve the same desired effect. There isn't a lot of evidence of methylphenidate withdrawal, but based on class discussion, the expected outcome would be abnormally low dopamine levels that could result in a lack of motivation or in anxiety and depression-like behaviors. These withdrawal symptoms should go away as the body returns to its normal homeostasis. However, a few studies have evaluated neurobiological changes that result from long-term use of methylphenidate if it started in childhood or early adolescence. It found that individuals' emotional and motivational responses may be permanently altered, leaving them less responsive to natural rewards and more sensitive to stressful situations and anxiety. If taken by the prescribed route, which is orally or occasionally transdermally, methylphenidate has a very low abuse potential because its reinforcing effects are negligible. However, if taken intravenously or intranasally, there is a much higher abuse potential since these methods of administration are more fast-acting and have a greater bioavailability, leading to a significant increase in dopamine that is highly reinforcing. And I was unable to find any evidence of physical dependency.